Now, live with Greg Olson, Director of the New York State Office for the Aging.
Well, good afternoon, everybody. Thanks so much for joining us. I do want to say before we begin with this really important topic that I'm excited to cover, please share this. There are so many advancements that we're going to talk about today in terms of dementia, Alzheimer's disease, and how to protect yourself. But I'm going to urge you to please share this to anybody that you know. My name is Greg Olson. I'm the Director of the New York State Office for Aging. As I said, this is a topic that we need to have a dialogue about ongoing, not just one time. And I know it can be a scary topic. People have seen people with memory loss or Alzheimer's disease, and it can be very scary. But there are a lot of things also that mimic memory loss that have nothing to do with dementia. And so early detection is so important. I have three really great guests and friends with me today that are going to talk through some of this for us and for you and your families. I want to throw out a number, though, 6.9 million. According to the Alzheimer's Association, in 2024 data, that's the number of individuals that are living with Alzheimer's dementia. It's about 10% of the population. And as we know, because the population's getting older, the likelihood of those numbers increasing is, I think, fairly obvious. These numbers in itself should give anyone pause. But as the 2024 report aptly states, because the population is growing, so will this issue. But there are things that you can do. This highlights really the need to have this discussion. And it's not, again, a one-time thing. It's something that we all need to be aware of to protect ourselves and to get into care earlier if possible. So part of the discussion today is going to be not only on early detection, but what are the preventive steps that we can take? So things like, having your hearing checked, staying socially engaged, eating well, exercising can significantly reduce the potentially getting dementia and Alzheimer's disease. So touching on early detection, I'm extremely proud of this project that was started with SUNY Upstate and Syracuse University, along with our office, to use the mini-cog. And we're going to talk a little bit about that to screen for earlier detection. But let me introduce our fantastic guests and friends that are going to be with us today. So we have Dr. Sharon Brangman. She's a doctor, SUNY Distinguished Services Professor, and chair of the Department of Geriatrics at Upstate Medical University, which is in Syracuse, New York, where she also directs the Upstate Center of Excellence for Alzheimer's Disease. And we have a bunch of those centers around the state that really specialize. Dr. Brangman, thank you so much for being here.
Thank you for inviting me.
Thanks. We have Dr. Maria Brown, who's Associate Research Professor at the Aging Studies Institute at Falk College at my alma mater, Syracuse University. Maria, thank you so much for joining us.
Thanks for having me, Greg.
And last and certainly not least, my friend Erica Salamita, who's the Director of Community Outreach at the Coalition, the New York State Alzheimer's Association chapters. Erica, thanks for being here.
Thanks so much.
So again, there are terms that we use. I remember being one of those people where, I knew what the word sepsis was, but I didn't really know, I heard the word, but didn't know what it is. Everybody's heard of Alzheimer's disease, but Dr. Brangman, let me start with you. What is it and what causes it?
So Alzheimer's disease is a brain disease. It's an actual change and death of the structures in the brain and the brain cells. And everybody thinks it's just memory, but it's more than that. It goes into destroying our ability to think, to function, carry out everyday activities, and it actually can change behaviors and personalities. So dementia is a broad term for all the diseases that affect the brain and cause the brain to break down and for the brain cells to die. But in the United States, Alzheimer's disease is the #1 cause of dementia. So that's why you often hear these words interchangeably. But you've heard about athletes who get a lot of concussions. They get a form of dementia. You can get dementia from strokes, from Parkinson's disease, from HIV. But Alzheimer's disease is the number one cause, and so that's why we talk about it specifically.
Yeah, and I think what's really important about today's conversation is, again, I know how scary this is for families. It's in my family, it's in a lot of people's, or they certainly know somebody. But we can't be in denial because there's things that we can do, and I know you guys are going to talk about that. What are some of the early signs? And anybody can jump in on that.
Well, the earliest sign is somebody who is just not as on point as they used to be. There are normal changes that happen with our memory as we get older. So as we get older, it may take a little longer to retrieve information because our brains may slow down processing. You may see somebody approaching you at a dinner or a party and you recognize their face and you can remember other things, but your brain is going through all the files to get to that right name. Usually you can retrieve it. It may not be for a few minutes and it can be very embarrassing. But you shouldn't think that just because you keep forgetting where your cell phone is or your keys are that you have a problem like Alzheimer's disease. Alzheimer's disease doesn't just affect memory. It also starts to impact your ability to get through the day. So people start to have trouble driving. Maybe they get into fender benders or they get lost in familiar places. I have a patient, for example, who went to the same hairdresser for many, many years. And one day there was some road construction and a detour, and she could not find her way back. It took her over 2 hours. So we have to see a functional change along with the memory loss. And then we often see behavior problems. Somebody may be less social. Maybe they have signs of depression. Maybe they get agitated or aggravated over things that really aren't a big deal. So we have to be able to look a little bit more broadly than just memory loss.
Yeah, and I'm really glad you talked about, general things that really aren't dementia, right? Just we all have it. You use the example of forgetting where you put your cell phone or where you might drop your keys. So I think that's really, really important. Can we talk a little bit about New York State? Because obviously that's the state that we live in. Dr. Brown, Erica, what does it look like in New York State in terms of numbers, ages, and any other interesting data? Because I know there's been a lot, there's constantly new data coming out, but talk a little bit about that.
Sure, I can jump in there, Greg. So as you mentioned, about nearly 7 million Americans. We have about 426,000 people in New York State with Alzheimer's disease. And, I always say those are likely underrepresented, the 7 million, the 426,000, because those are the people that we know about. Think of all the people that you may come in contact with in your life and your work that you think to yourself, I think something's going on here, but they don't have that diagnosis. So I do think those numbers are probably a bit higher. We also have about 543,000 caregivers. And again, these are the caregivers that we know about. Not everybody calls themselves a caregiver or would characterize the tasks that they're doing for their loved one as caregiving tasks. These are simply things that they're doing, out of love for that person. So definitely two significant numbers there. In terms of the folks that have Alzheimer's in our state, the majority of them are 65 years of age and older. But, a couple of things to know. A year or two ago, there was some very interesting county level data released. And one of the things that it showed was Bronx County in New York State has the second highest prevalence rate in the nation. So we've certainly got some work to do here. New York State is the second highest state in the U.S. in terms of prevalence. And there's plenty of, work for all of us to do to support these individuals.
Yeah, I didn't know that about the Bronx. I appreciate you raising that. One of the other things that we can do here is dispel myths. Alzheimer's disease is not a normal process of aging. And I think Alex just put up a lower third that showed 40% of it is preventable. But I think what I wanted you guys to also talk about is, again, the fact that we can't be in denial. There are conditions that we have that can mimic memory loss that really aren't. which is why early detection is so important. So, things like medication interactions, UTIs, sepsis, alcohol use, et cetera. How do you distinguish between Alzheimer's disease and other conditions that might have similar symptoms? And what would you recommend?
So basically, we have the skills to kind of sort that out. A lot of people have sleep apnea, for example. They snore or maybe stop breathing and get low oxygen levels. That can make your brain not work right. But when we do our evaluation, we can figure out, is this Alzheimer's or another dementia, or is this related to something we could treat?
Right.
We look to see if somebody might have vitamin deficiencies, that thyroid is working correctly. But probably the biggest concern are all the medications that we take, especially the ones over the counter. And a lot of them can slow down brain function, especially as you get older. We also see a lot of people who have problems sleeping because as we get older, we don't go into that deep sleep. We have frequent awakenings. And sleep is actually the time that our brain cleans up all those chemicals and toxins from the reactions of working all day. So if you're not getting a good night's sleep, that can make you look like you have dementia when you really don't. So we have to take a good sleep history. Alcohol, which is socially acceptable and everybody is doing it and they make jokes about it, it's actually very toxic to brain cells. And there's really no amount that's good. So we talk to people about how much they're drinking. And, I'm not popular at parties or anything, but it is something to think about, that we have something that's totally preventable, but we are using it in a way that could slow down our brain function. So that's why I want to kind of emphasize how important it is to get an overall assessment of everything that you're doing. We do a brain assessment. We look at your physical function. We do a physical exam. We look at all of your medical problems and medications, and then help you sort out what's going on.
So I'm going to jump ahead and I'm going to come back because I'm going to ask you guys to do this again. You talked about that, Dr. Brangman. How do people go about that? So you are in one of these centers of excellence around the state. There's going to be people watching from all over the state. How would they go about the process of reaching out if they're concerned to get screened?
So if they're concerned, they can talk with their primary care doctor. What I always tell patients is, if somebody is telling you, well, what do you expect at your age? Everybody forgets when they get older. That is not normal, and you should not accept that as an answer. So if you don't have access to a primary care doctor, you can certainly contact the Center of Excellence for Alzheimer's Disease. They're scattered across the state, so most people should have access to them. And I know we have that contact information. But all of these centers work on the standard cutting edge information we have for evaluation, assessment, and treatment. And New York State is actually leading the way in the country for addressing these issues, because New York State really recognizes the burden that this disease places, not only on the individual and the caregiver, but our healthcare system, and also all their other medical problems. I sometimes call Alzheimer's a foundational disease, because if you have that, then we have to manage it extra carefully if you also have high blood pressure, diabetes, chronic pain, or even a cancer, because it impacts just about everything in your healthcare.
Yeah, thank you. So let's move to community. I am a huge fan, Erica, of the Alzheimer's Association nationally, your organization representing the state chapters, and then, of course, the state chapters. Talk a little bit about what the Alzheimer's Association does and how you can help families and how they can reach out to you.
Sure. Thanks, Greg. So the Alzheimer's Association, as Greg said, is really, we are a national organization. We're a nonprofit. We are the leader in care support and research in the Alzheimer's field. So we do have chapters across the country. Here in New York State, we have 7 chapters, and we cover all 62 counties of our state. And we provide free care and support services to New York State constituents. So lots of education. We start with the basics, Alzheimer's disease awareness. How do you recognize those warning signs? What do you do when you notice a sign? What are the ins and outs of the disease? What do the stages look like? How do you plan? We talk about healthy living a lot and do a lot of education in that area. And then we offer a lot of caregiver education as well. As much as I know today, we're going to talk about some of the things that you can do to reduce your risk before you have this disease. It's really important that we continue to provide support for the families that have it now. So caregiver education is a huge piece of that. Telling caregivers, how to, improve their communication strategies, how to manage behavioral challenges that might pop up, how to plan for the future and where to go for care and support and the resources that they're going to need now and into the future. So education is a huge piece. We do offer support groups for both caregivers and people living with the disease in the early stages throughout our 62 counties. And then, care consultations. I like to say, we always say this is kind of the bread and butter of what we do. This is our opportunity to really meet with a family or an individual. It's a free service, and learn a little bit about their particular situation, where their challenges are now, what resources that they might need to connect to right now, and where we're headed in the future. So it involves us, learning from them, seeing where they're challenged, and helping them really put a care plan in place so they're set up, for some success in the future and can get connected to all of those really critical resources. So care and support, we do that across all 7 chapters in New York State. Nationally, we do a lot to advance research. We are the largest nonprofit funder of Alzheimer's research in the world, and also to advance care and support. We've had many advances in terms of different care models that are proving to be really effective for Alzheimer's disease. And we could not get there without, research funding and certainly being strong advocates.
Yeah, and thanks for that. I've asked Darren to pull up one of our support platforms. I know that our, offices work really close with your chapters. Dr. Brangman talked about, daily tasks and how this disease can impact those. That puts a lot of pressure on family, friends, and neighbors. And, us in the industry, we use this term caregiver. I wish we could come up with another one. Because people don't self-identify. More than 50% don't self-identify as a caregiver. They self-identify as a spouse, a son, a daughter, etc. And so, really trying to focus on what those tasks are really important. And there's a lot of services that you provide, but we also do, like, home delivered meals or personal care, transportation, that take those tasks off of folks. But one of the things we're so proud that we have launched that is free for any caregiver of any age in the state of New York is our New York Caregiver Portal that's powered by Trualta, that can really be customized towards who the person is caring for. And clearly somebody with dementia or memory loss is part of that. So Darren's going to pull that up. Dr. Brown, how can somebody protect themselves? We know that you can reduce your risk. We know that this really starts years before symptoms. So, somebody in my age bracket, 56, or somebody who's 40, or somebody who's 30, what are the types of things that we can be doing, as Dr. Brangman talked about, to prevent this that is not a normal process of aging?
Well, there are a lot of things we can do to be proactive about our general health. We can get routine physical exercise. Almost any condition you have as a middle-aged adult can be improved by walking 5 days a week, about half an hour a day. You can do things to manage those chronic conditions that can lead to dementia. Like if you're a diabetic like I am, you can work on keeping your diabetes under control and relying more on diet alteration and activity alterations than just adding on medications, because the more medications you have, the higher risk of medical interactions that can cause things that look like dementia. So just generally maintaining our health, getting more routine exercise, and paying attention to our health as it evolves with aging.
Excellent. So I hope everybody hears that and takes that. And then, of course, Dr. Brangman is not a popular person at parties, reduce your alcohol, get screened early. So we're going to take a short break before we come back. I don't know if you've ever heard of MOLST. It's called the Medical Orders for Life-Sustaining Treatment. It's a document that guides caregivers in consultation with your primary care physician if you want to make decisions on behalf of a seriously ill person or yourself. So watch this video and check it out. Thank you, Alex. You know, one of the things that drives me nuts about how we organize our health and long-term care system is we don't focus on prevention. We focus on waiting, and then sometimes for some folks, unfortunately, it's too late. It's very expensive, prohibitive, and I'm hoping that those are the types of things that change. Erica, you were recently at an Alzheimer's International conference where, again, there's constantly new data. There's a lot of research, as you said, that you guys are the #1 funders of that. Talk a little bit about what you learned, and I'm really interested in the environmental factors because that does have an impact.
Absolutely. So we know, just as Dr. Brown was saying, lots of research came out around those modifiable risk factors. And, you know, those are positive everyday actions that we can take to reduce our risk for Alzheimer's disease and dementia. But in terms of environmental factors, we're learning some really new, interesting stuff there as well. We already know that our natural environments and our built environments can really impact our health and our well-being. But now we're starting to see, and this was research that came out this summer at the conference, that this can also affect our cognitive functioning. So we're looking at both indoor and outdoor air pollutants, and we know they're associated with increased respiratory illnesses, cardiovascular issues, and now there's also emerging evidence to say that they may also increase your risk of dementia. One of the really big studies that came out this summer at that conference was on wildfire smoke. So if you look at the fine particulate matter from the different types of outdoor pollutants that are out there, wildfire smoke and emissions and automobiles and factories, what they found was that the wildfire smoke was significantly more dangerous and posed a much higher risk compared to other sources of pollution to impact a person's risk to develop dementia later on. So this is really important because we take a look at what's gone on in the last couple of years. Lots of fires in California, you know, the tragedy that's occurring in LA, things that have happened in our own state, and this is really concerning. So, you know, that wildfire smoke was an interesting thing that came out. Also, a lot about green space. We're learning now. There's emerging evidence that the more access that you have to green space, the better overall brain functioning that you have as well. So, just a few things that were exciting out of the many that came out of that conference.
Yeah, I think it's, I had no idea about the wildfire smoke. That's stunning. I think we had the largest fire in Orange County in whether it would be decades or ever. And then, of course, you know, California, it seems like it's every year. I had no idea about that. One of the things, again, so proud to partner with Syracuse, Dr. Brown, Dr. Brangman in upstate with 7 of our counties on a early detection screen. So I'm going to ask you guys to talk about that. But Dr. Brown, talk about this pilot, where the idea came from, and what have you learned or found so far?
Sure, Greg. Well, initially, I think it was back in like 2016, Sharon's office partnered with Focus Greater Syracuse to form a coalition of family members and older adults and practitioners, clinicians, social service providers, and university researchers to find out what issues were most important to older adults. And the number one issue that they said was they wanted to remain independent in their home, and they wanted to be able to detect problems early so that they could stay there in their own homes. And so we had a neighborhood advisor from the Onondaga County Office for Aging was at that meeting and came to us afterwards and said, I think it's got to do with early detection of dementia or something like that, because she could tell that some of her clients just had something going on, but she didn't know what it was or how to assess for it. And she didn't have any way to really effectively refer them for further evaluation. So we all came up together with this idea. We did it on the south side of Syracuse in 2018. Did some screenings with the mini cog, which is a brief cognitive screen, takes about 5 minutes. And it can tell you if a person has some signs of possibly having an issue. So it's not a diagnostic, it's just a screening. We found that 28% of those older adults that we screened in that year had some signs of potential impairment. And so then we went about educating everybody, including the State Office for Aging, about the pilot. And we got some funding last year to do a larger pilot in 7 counties. And that's what we're doing right now.
Yeah, and I want to thank the Health Foundation of Western and Central New York, as well as the New York Health Foundation for supporting that. And I saw one of our county Office for Aging directors in Chemung County just posted something. And so, Beth, these are things that can absolutely be done. So I'm going to ask Dr. Brangman to walk through how simple the screening process is and what the mini cog is, because this is something I would like to see not only replicated across New York State, but across the country, clearly.
Absolutely.
So the reason why it fits so well with the Office of Aging is because the workers already go into the homes and do a wide range of evaluation and screenings. So they're perfectly positioned to learn a new skill, and they already have access to people in their homes. And the whole idea is to identify people early so we can avoid that crisis. By the time somebody realizes they need help, they need to be seen immediately, and that can be a challenge. So using the information we got from this pilot, that we did a training session with Office of Aging county workers, right? And we taught them how to do the mini cog. They had ample opportunity to learn it, ask questions, role play, and rolled it out, and we have been amazed at the results. So
I'm sorry. Before you go on with what you found, go a little bit deeper into what the mini cog is, because this isn't like a 30-minute screen. This is super simple. So if you could just talk about what the mini cog actually does.
So the mini cog was developed by one of my colleagues, and it asks somebody to remember 3 words and then draw a clock with a specific time on it, and then repeat those 3 words. So it's a short-term memory test with a little distraction by drawing the clock and then asking them to repeat those words. It's been shown to work across any educational background, across racial backgrounds. A lot of tests have biases in them, and this one has been shown to be very simple to administer. It doesn't give us a diagnosis. It just tells us somebody who we need to look a little bit more closely at. Because as Dr. Brown mentioned earlier, it's not a tool to make the diagnosis, and that means we look a little deeper, and a lot of times we find other things than dementia. So we want people to embrace this and not be afraid of it.
Yeah, completely agree. And I appreciate you saying that, because I wanted folks, anybody who's front facing with an older adult, is a really, really simple screen. And I'm glad you have said over and over again, it's a screen. It's not a diagnosis, because we've gotten some pushback from folks that work in and around Alzheimer's disease that it's not appropriate for a non-clinician, but that's not what this is. We screen for depression. We screen for anxiety. We screen for alcohol. We're not making a diagnosis. You want to detect and then get to the experts.
Exactly.
And it's important to note, Greg, that when these caseworkers go into people's homes or when they come into your Office for Aging for a screen, caseworkers don't talk to them about dementia or cognitive impairment even, or any of those technical terms or diagnostic terms. They just merely talk about memory. right? Because we all experience some degree of memory changes when we're older. So even a 3-word list, someone might not remember all 3 words, but because they can still remember 2 of the words and do the clock drawing in between, they're still considered cognitively normal. So it's not even an issue of can you remember all 3 words? It's just an issue of do you have memory that's normal for your age?
Yeah, I've seen drawings of the clock. Just something that simple where somebody had then been referred, and it's stunning to look at, a clock that's not drawn correctly and what that indicates. So all 3 of you guys, if you want, you can, answer this. We always try to do these things not only to educate, but if there's not an action associated, then what good is the program, right? We want people to get resources. We want people to connect. So how do they do that for each of you guys? What should they do? What types of things are out there to support them? And I know, Erica, you talked a little bit about this, but I don't think we can underscore that enough. I mean, certainly can go to the Offices for the Aging for some of those task-oriented services that we provide. But from your 3 perspective, what are other things that are out there, including medications and clinical trials that might be available and open for somebody?
So,
go ahead, Dr. Bregman.
Sorry. Well, one of the reasons why we want to evaluate someone early, and if they do have signs of a more serious memory problem, it's important because medications that we have right now are most effective when you start them early. Our site at Upstate also runs several clinical trials for medications that are under development as possible treatments for Alzheimer's disease. And again, to participate in these trials, you have to be on the early end of the spectrum. And it's also important because when you're diagnosed early, you can participate in your care and help make decisions so that your family knows exactly what you want done. You talked about the MOST form a little bit earlier. We review the MOST form so people can tell us what's important and what matters the most to them. And that provides a lot of relief for caregivers because then they're not second guessing and they know they're following your wishes. But most of all, this gives us the opportunity for education, an education of the patient and the caregiver, what to expect, to know what resources are. We refer many of our patients to our local Alzheimer's Association so that they know what the resources are and what's available, because an educated caregiver is usually less stressed. And that's our goal because we know this is a super hard job and education helps to reduce that burden.
Yeah, thank you. And Erica, before I'm going to ask Darren and Alex again to pull up our evidence-based caregiver portal that's powered by TruAlta so that people have, again, an additional resource. It is free for any caregiver in the state of New York. There's 4.1 million people out there providing uncompensated care to somebody else, regardless of age. So please, jot that down either today or when you're looking at this in the future. Erica, anything else that you want to add or to reiterate? Because I think what you guys offer is so important.
Yeah, thank you. And Dr. Bregman said it so well. I think, first and foremost, don't ignore the warning signs. We talked a little bit about those today. What's normal, what's not normal. Go on our website, alz.org. We've got it all outlined there. And then have a discussion immediately, as soon as you can, with your provider. As Dr. Bregman said, there are medications now, but they're only appropriate for people in the very early stages of the disease. So we don't want you to miss that window. And then secondly, don't go it alone. You don't need a diagnosis of Alzheimer's disease to contact the Alzheimer's Association or many of the resources that we're listing here today. Even if you don't know what you want to ask us, we will help you outline, a care plan for you to get you connected and started down, the right path to get those care and support services. And then probably, Greg, just to underscore the piece that I am most hopeful about right now, and I've been in this field for 24 years, is where we are in terms of reducing your own risk. This is not just something that we should be thinking about as an older person, in the later part of life. We need to think about this now. We need to put some of these healthy lifestyle changes in play in our own lives now so we can reduce our risk. So at some point, we see those numbers that we mentioned at the very beginning go down and not continue to go up.
Yeah, and I think that a lot of the things that you guys have talked about in terms of healthy lifestyles, I go through every year the governor's budget, right? And Governor Hochul has put a lot of things forward in this budget this year that you guys are talking about, like more access to green space, right? More access to farm fresh foods through Nourish New York, free meals for kids, et cetera, et cetera. So sometimes we just got to connect the dots and point out that the things that we're trying to do here on a global scale that are going to affect communities, the built environment, we're going to have a positive impact for people, not only staying connected, but breathing fresh air, exercising, and so on. So we're going to take one more break before we get to questions. One of the questions I'm going to ask you guys as we come out of break is, I think that there's a lot of folks that think once I have it, it's going to progress quickly. I want you to come back and answer to me, are there medications now where if you're in early, can really have a significant impact on slowing the progression of the disease? But I want to take a break here. I had an interesting number that I saw in terms of our YouTube channel. So many of you who are watching this are probably watching it through YouTube. If you're not, please like it. Since we've started these programs, not just this one, but other things that we're doing, we've had 4.9 million views. So check this out.
Hi, I'm Molly Ryan, and I'm a communications intern for the New York State Office for the Aging. I am so happy to be on board with this agency, and I'm for sure learning a lot. I have recently learned about the agency's YouTube channel, which has so many resources for older adults and their caregivers. There's a reason they have millions of views. Like and subscribe today.
She's great. She was one of our interns this summer. Did a fantastic job. So let's get back to that question. Talk to me about some medications and just the advancements.
So recently, there's been a new class of medications that have been approved for use for people with very early stage Alzheimer's disease. So one of the drivers for this disease is a buildup in the brain of an abnormal protein called amyloid. And amyloid is like a sticky protein. If you think of the nerve cells in your brain like a delicate spider web, this protein goes in there and gunks up that spider web, and those nerve cells get all bunched up and they don't send messages anymore. And these medications that were recently approved by the Federal Food and Drug Administration help to remove that abnormal protein. And it's been shown that does give a modest reprieve from progression of the disease. These medications are usually available at a big medical center, and they need very close and careful administration and follow-up and watching out for side effects and things like that. There are other drugs that are coming through in different categories, and you can possibly participate in a clinical trial. We have other medications that have been out for many years that don't change the course of the disease, but can help reduce some of the symptoms. Our goal is to really help someone maintain the highest quality of life and the highest level of function for as long as possible. And everybody has this disease in a different way. So people often ask me, well, how long does it take for this disease to run its course? And it can be 10 to 15 years. And if you think that some people have the disease before we know it, by the time they come to my office, they might have already had it for 2, 3, or 4 years. So you can think of it as a real chronic disease that starts quietly and then becomes more prominent over time as you lose more and more brain cells.
Great. Thank you. So let's move into some Q&As from our audience. What is the difference between Alzheimer's disease and dementia?
So
I'll take it this time, Dr.
Yeah, okay.
So dementia, I like to say dementia is not really a true diagnosis in its end form. It's a classification of symptoms. And we know what those symptoms are: problems with our memory, our reasoning, our judgment, problem-solving skills. But it can come from a variety of different causes. So it's that umbrella term. And Alzheimer's disease is one form of dementia, but there are many different kinds of dementia out there.
Great, thank you. My mother had dementia. Does that mean I will get it? That's a great question.
Well, that's probably what most people are most afraid of.
Right.
And there's a small group of people who have a genetic basis for it. And those are mostly people who get Alzheimer's disease in their late 50s and early 60s. But the majority of people who do get Alzheimer's disease don't have a clear cause and effect from someone in their family. That might increase their risk a little bit, but it's not a guarantee that you're going to get it also.
Great. Thanks.
But it does give you an opportunity, Greg, to make those earlier life changes and modifiable risk factors to be preventative, so you don't have to worry about getting it. I have a friend who's 90, whose mother had dementia in her late 50s, early 60s, and my friend has lived a very healthy, conscious lifestyle to avoid that, and she has not developed dementia. So it is totally avoidable if it's not the genetic kind, which again is rare cases. It's avoidable through modification of risk factors now.
Yeah, I think that is such a critical point, right? That if you do have somebody in your family, you should be paying a little bit more attention. I think we all should, but that should be a highlight. I just want to let the audience know, when we zoomed in on Maria, you can see all the students at Syracuse laying on the grass. That is clearly not live.
No, definitely not.
This is another fantastic question. Do the memory supplements advertised on TV work?
No.
I could take that one. That's a no. Currently there's no supplement that's been proven to treat, cure, reverse or really benefit cognitive function or reverse Alzheimer's disease at all. There are a lot of them out there that we're aware of that are really making false claims. These are not subject to the FDA's, rigorous testing and requirements there and regulation process. Therefore, we don't really know if that data has been scrutinized at all. We don't know if they're safe, to take with other medications. And certainly it hasn't been proven effective in any kind of large scale study. So, the general answer is no. We can say that we know that whole food sources are really the best way to go in terms of getting your vitamins and minerals and the nutrients that you need to really maintain a heart healthy diet. So general answer there is no.
I always tell my patients, if those worked, I would be handing them out and I would retire.
Exactly.
Yeah. And what you guys are saying is so important, right? Because fear sells, and I'm sure people are making hundreds of millions of dollars on, what I don't know what's in them, but it's basically a placebo if it doesn't work. So better off using your dollars to buy good foods and, maybe go to a park and exercise or get a gym membership if you're able to do that. Any other questions, Alex?
Can I also add, Greg, that if you're concerned about your memory or your cognitive function, the best course of action, rather than taking a pill you saw advertised on TV, is to talk to your primary care doctor. And if your primary care doctor is not paying attention to your concerns, then you can reach out to the CAD in your area. You don't need a referral from your physician to go to a CAD to have any sort of evaluation of your memory. To put your mind at ease, just talk to a doctor.
Yeah, and I think your earlier points of, if your doctor says, well, what do you expect? You're getting old, that's a red flag right off the bat, right?
And if you're a woman, you hear that all the time. Oh, it's probably menopause. You don't have to, there's nothing that can be done for you. Well, don't accept that answer. Ask another doctor or find a specialist. And luckily, the CAD doesn't require a referral from your doctor for your insurance to cover it. So you can go right to them if you're concerned.
And again, the CAD is the Centers of Excellence in Alzheimer's Disease. They're located all throughout New York State. You've got the Alzheimer's Association website where you can find resources, local chapters. They work very closely with our network of aging service providers across the state. We have the Trualta app, which is evidence-based. There are peer support groups. So, a lot of people think that they're the only ones, dealing with this. It is not true. There are thousands and thousands of families where people can help support themselves. And there's really nothing better than peer support, especially going through a difficult time. Dr. Brangman, Dr. Brown, Erica, it is such an honor to have you with me today. This is, again, a conversation that I don't want to just have once. I'd love to have you back on, even if we're covering some of the same things, because you can't hear the messaging enough. So I thank you all for being here. Again, for those who are listening live or who are going to be listening in the future, please share this with anybody that you can. There's a lot of good advice in here of things that you can do to help prevent dementia and Alzheimer's disease, as well as resources that can help support you. So our next show is going to be with my friend Jim Furman. He used to be the CEO of the National Council on Aging, is now with Better Age, has developed a platform which I absolutely love and we've supported and we are implementing throughout New York State that really digs deep into individuals, how they view themselves, how they're doing, where their needs might be. I mean, what a novel concept to actually ask people, about themselves and what they want and what they potentially need. So this is a real important public health tool that I'm excited to bring here to New York State to, again, continue to try to serve older adults and their families the best way that we can so that they can age in place with dignity. So as always, I want to thank my communications team, Alex, Roger, and Darren, for doing a spectacular job, and of course, my three great guests. So we'll see you next time. Thanks so much.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau. Please join us next time.